Hi everybody, this is Mr. Matus again, and I'm here to discuss with you the autonomic nervous system. The autonomic nervous system has two other divisions. You have the sympathetic nervous system and the parasympathetic nervous system. So what I will be doing is I'll be discussing the functions of each division, and I'll also be discussing the differences among the effects of this sympathetic nervous system and the parasympathetic nervous system. So let's go and proceed with this discussion. So the autonomic nervous system consists of the sympathetic nervous system and the parasympathetic nervous system. It is concerned with the functions essential to survival. So the two divisions of the autonomic nervous system generally function antagonistically, meaning it's the opposite toward each other. So it means to say that if you know the effects of the sympathetic nervous system, then you also know the effect of the parasympathetic nervous system. So that's the easiest way for you to study. So both of these systems actually help in maintaining the homeostasis in the body, and that is either by stimulating or inhibiting the smooth muscles, the cardiac muscles, and the glands of the body. So let's compare both. So the sympathetic nervous system is mainly responsible for the fight or flight response, which means to say that it helps the person adapt to stress. And the main neurotransmitters under the sympathetic nervous system will be your epinephrine, your norepinephrine, and dopamine, which are neurotransmitters being released at the end of the nerve fibers. Now, you have to understand that your norepinephrine is being converted to epinephrine. Now, the main function also, or the main effect of the sympathetic nervous system is the stimulation, except the gastrointestinal system and the genitourinary system. This is one concept that I really would like you to focus on in terms of the effects of the sympathetic nervous system, which is to stimulate, except the gastrointestinal system and the genitourinary system. And I'll be discussing that on the next slide. The parasympathetic nervous system is what you call the rest and digest, because it's more of a system that is responsible for the conservation of energy and the elimination of waste. And the main neurotransmitter here is your acetylcholine. So the effects of your parasympathetic nervous system will be the inhibition, except the gastrointestinal system and the genitourinary system. So what you will notice here is that for both of them, they have antagonistic effects. So it means to say, as what I have said, that if you know the effects of the sympathetic, you will know the effects also of the parasympathetic. And that would help you a lot in your NCLEX. So that's my first NCLEX quick tips for you today. So let's go over the specific effects of your sympathetic nervous system against your parasympathetic nervous system. But before that, let's find out what are the similar names for your sympathetic nervous system and your parasympathetic nervous system. The other names for your sympathetic nervous system will be adrenergic, coming from the word adrenaline. It's also called anticholinergic, sympathomimetic, or parasympatholytic. The other names for your parasympathetic nervous system will be cholinergic because of the neurotransmitter, which is your acetylcholine, or you also call this parasympathomimetic or sympatholytic. Now, I have an NCLEX tip for all of you. If you memorize these terms over here, this will help you a lot in studying for your pharmacology, because a lot of times when you're studying drugs, sometimes the material will tell you that the medication has an anticholinergic effect or it has a cholinergic effect. So as long as you know under which division the terms are under, then it's easier for you to know also what are the effects of those medications. And that's the secret when you're studying pharmacology, to know the action of the medication, because everything will follow, the side effects and the nursing interventions. So for sympathetic, there will be an increase in the heart rate, while for parasympathetic, there will be a decrease in the heart rate. For blood pressure, there will be an increase in the blood pressure for the sympathetic, but under the parasympathetic, that would be decreased blood pressure. For respiratory, you will have increased respiratory rate for sympathetic, while for parasympathetic, you will have decreased respiratory rate. Now, I want you to be very careful when it comes to the effects on the pupils, the bronchus, and the blood vessels. For the pupils, in order to adapt to stress, the pupils will be dilated in order to increase the visual field. Now, for your parasympathetic, the pupils will be constricted. The bronchus will be dilated to adapt to stress, while for the parasympathetic, the bronchus will be constricted, or you're going to have a bronchospasm. Now, for the blood vessels, what you have will be constriction, and for the parasympathetic, you will have dilation. So I would like you to be careful about this effects here, dilation, and here you have constriction. And constriction of the blood vessel actually contributes to the increase in the blood pressure. Increased heart rate also leads to an increase in the blood pressure. So these effects are actually interrelated. Now for the bladder, as what I have said, your sympathetic will be stimulating the other parts of the body, but when it comes to the bladder, it will be inhibiting it. So inhibition happens here, and that leads to bladder retention. While here, for the parasympathetic, it's stimulation of the bladder. The digestive system is inhibited under the sympathetic nervous system, so that's why you have dry mouth and constipation. And that's why when you say that a medication has anticholinergic effect, there are three main effects of that. That would be urinary retention, dry mouth, and constipation, and these are common among psychiatric medications. For parasympathetic, what you have will be the stimulation of the GI, and the person will have increased salivation and diarrhea. So I would like you to focus on this part over here on what's being stimulated or inhibited. Under the Sympa, your GI and your bladder or your genitourinary system are inhibited. But under the parasympathetic nervous system, your bladder and your digestive system are stimulated. So it's very important for you to remember this part of the discussion. Now, under the sympathetic nervous system, in addition, there will be release of glucose from the liver, so there will be stimulation of the liver, and the reason for that is because under stress you need more energy, so the liver will convert the glycogen back to glucose so that you have a source of energy. And that's the reason why during stress the person can lift very heavy objects and can survive for a longer period of time because of the source of which is the glucose. For the parasympathetic nervous system, there will be inhibition of the liver, and that means that your glucose will be converted back to glycogen. Now the adrenal medulla, which is the gland found on top of your kidney, will be stimulated, and they will release your norepinephrine and norepinephrine, while your parasympathetic nervous system will inhibit the adrenal medulla. So this is the very good illustration of the differences between the effects of the sympathetic nervous system and the parasympathetic nervous system. And if, again, my advice to you is that if you know the effects of the sympathetic nervous system, then it's easier for you also to know the effects of the parasympathetic nervous system. And knowing the effects of the Sympa and the para will help you a lot in studying your pharmacologic medications. So I have a quick NCLEX tip to everyone. I would like you to remember the mnemonic sludge. And sludge stands for the effects of the parasympathetic nervous system. S, which is salivation, which represents the stimulation of the GI. Lacrimation. U for urination. D for defecation. G for increased gastric motility. And E for emesis or vomiting. So this is a very nice way for you to remember the major effects of the parasympathetic nervous system, or the cholinergic effects. So there you go, everyone. That was just, again, a very quick review of the autonomic nervous system, which is your being composed of two main divisions, which are your parasympathetic and your sympathetic nervous system. So if you have any questions or if you have any comments, please write it below. And please don't forget to click like or share my presentation to your friends. And please subscribe to my channel. And also don't forget to visit my website at www.matusnursingreview.com. Thank you very much, everyone.